No, but he couldn't get to the parade. We decided to just come by.
All right.
Okay, good morning. Welcome to the November 9th meeting of the Board of Riley County Commissioners. Let's stand for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, do we have any public comment this morning? Yeah, Clancy.
That's all.
Can you guess?
Yeah.
I'd like to ask the board to add an executive session to my admin time, please.
That'd be at 9.
Yeah, 9.
Okay.
Make a motion to add an executive session to Clancy Holman's administrative work session. Services time.
No second. Okay. Excuse me.
It's been moved and seconded to add an executive session to Clancy Holman's time at 9 o'clock. All in favor?
Aye.
Aye.
Thank you, Commissioner.
Okay, having no public comment, I will go to commission comments. Commissioner McKinley.
All right. Well, Monday, we attended the women's game and then went home and watched the men's game. It's good to be back in the basketball season. Men didn't win, but they learned what they know now what they need to work on. Yeah. Tuesday, had a home visit by someone concerned about the Keats Sewer project. There were a lot of things he doesn't like about the projects, and we had a long discussion. After that, I called Amanda to go over some of the things he brought up to clarify some of the citizens' facts that were not correct. I thought I knew what the answers were, but I wanted to check. Wednesday morning, Flint Hills Veterans Coalition meeting was filing up everything for the Veterans Day Parade. The numbers are up from last year, but they're still below pre-COVID numbers for some reason, down quite a bit. And then the Flint Hills Veterans has a Veterans Day essay contest for kids. So the only entries they got was from Manhattan Catholic. VFW Health does an essay contest, and they received entries from Manhattan Catholic, Wamego, Riley County, and others, but neither one received any from Manhattan schools. And they contacted them, but they don't care to participate in it. And then awarded the scholarships for this year. They've got two. It's $1,000 scholarship for veterans who are going back to school. 2 of them at Manhattan Tech and 6 at K-State. Then had a meeting with Jason Smith and Mike Madsen over at the Chamber of Commerce. I had questions about some things going on, and they kind of filled me in on those and discussed several items and local projects. Wednesday evening, I attended the comprehensive plan meeting in Riley. Hadn't been to one of those yet, so I got to it. Amanda did a good job of presenting those. There were only 9 people there. And not a lot of questions, but several positive comments that it was good information that they wanted to receive. So I think a positive reaction for it. Only in here I said Bob harassed me a few times, but that was okay. I harassed back too. And that's all I've got.
Okay, Commissioner Ford.
Yes, I guess I'll start off this morning with the Operation Greenlight update. Everybody's probably aware several teams put up lights up here on 3rd and 4th and 5th Streets here in downtown Manhattan on Monday. KAC did a nice long social media post on that and got it up and out. And some of the pictures that were taken were put up on NACO's national website that they had specifically for this. So everybody knows what we're doing. So it's good. And I wanted to take a moment just to tell everybody who's been involved in that process this week, thank you, and thanks for making that happen. Tuesday, of course, was local municipal elections here. I voted early, so I wasn't really part of the process on Tuesday, but I did want to say thanks to everybody here at the county who made those happen. It takes a team, and just everybody in the clerk's office, as Rich is nodding his head there, knows. So thanks to all the workers and volunteers at the precincts who made all that happen as well. It's quite a process. We talk about it all the time. I don't really understand everything that goes into that. I'd also like to say congratulations to everybody who won their respective races throughout the county. And I want to show my gratitude to everybody who made a conscious effort to run in these local races. They're very, very important, and it's difficult, not easy sometimes, as we were just alluding to. And I understand how difficult it can be to come up short in the end by putting so much effort into it and trying to get to that point. So thanks to everybody there as well. Wednesday afternoon, I had my monthly teams call with NACO's Community Economic and Workforce Development Committee. After some opening remarks from our chair, Martha Schrader, commissioner from, and I always love doing this, everyone, Clackamas County, Oregon. I just like that name. We heard from Ms. Nelsie Silva. She's the acting director of the Office of Intergovernmental Affairs with the United States Department of Labor. She talked about National Apprenticeship Week. I'm just trying to remember, do we do a proclamation and stuff for that? Have we done that in the past? My mind just doesn't seem to be. I'm not.
John's trying to get you another proclamation.
Yeah, wonderful.
Right.
How many whereas do you need? Under
As many that will fit on a page, and then we'll work on the back side of that.
we can deal with the fonts.
Now they do have a template. I thought we've done that in the past, maybe it wasn't last year.
Not gonna sound somewhere.
You guys are no help. Okay, well, we've done something in maybe 19 or 20 or something. I don't remember. Maybe we just talked about it or something. But anyway, there is a lot of stuff going on with that ordinance with it. Maybe that's something we need to think about. Maybe talk to MATC or a few other various groups on there. There is a template for a proclamation. I'll look at it, but I don't think we probably have enough time to do that at this point in time. So we're probably off the hook on that one. I'll leave that for next year. So, yeah. It is really kind of a good deal, particularly when we find ourselves trying to find ways to get people, I guess, acclimated back into the various workforces. And it's not just trades, it's nursing, it's there's a whole bunch of other sectors that this involves. So had a really good dialogue about it. I thought what was really cool was listening to some of the other counties across the country and some of the things that they're doing and already doing outside of just the week itself. So there's a lot of action going on with that. And then we heard from Spencer Taylor. She is the director of revenue recovery with NACO. They are putting together a new initiative called NACO Edge. And within that is a public promise insurance directive. And what they're working on is trying to group some things together, including ways to try to drive down the cost of insurance for counties. And it's something that we probably I'm going to keep an eye on and see what they do. But, there's 3.6 million county employees across the country. They're larger than, an Amazon, and they get deals on insurance. Why aren't counties getting deals on insurance? We see our rates going up 6, 8, 12% every year. So they're trying to find ways to incorporate some things and employee benefit packages to make it a little bit more conducive for counties. So something we're going to watch. I think it's important to pay attention to that and use that to our advantage. And I think she's going to come back in early 24. I don't know what that means. I'm gonna say like a February, March or something, and kind of go back through that, and we'll see where we're at. I'll be back out for the policy conference in February, so I might come up there too, and there may be a lot more to come on that. So I'm gonna keep my eye on that because I think there's some good stuff coming from that. Also, yesterday we had our pre-law board meeting at the Law Enforcement Center. Not really a whole lot going on with this upcoming agenda on the 20th. We will probably be discussing some usage for some leftover year-end funds. And then everything else is pretty standard agenda items. I'll be acting as chair for this meeting as our current chair will be out on vacation for the holidays. So we'll see how that goes. Really, other than that, it's just been work. We're way behind, and with the holiday coming up, it's not really helping. So that's all I got.
Okay. Well, Monday afternoon, I met with Clancy Holman, Shelley Woodard, and we met with the Keats property owner to go over the wastewater system's need of up to 15 acres and the offer we had made on the property. It was a lengthy meeting with no outcome at this point. Tuesday, I went to my polling place to vote, and it was pretty quiet in the morning, but they said they'd been real busy before work and looking, the new machine works really well. I was really impressed with it. So, and to be able to look at your ballot and then put it in, that's really a good add-on. Let's see, later that evening, I did watch the election results for county and national elections. It was good to see the election results come in. Wednesday morning, I attended the substance misuse task force meeting. It's not calling substance abuse, it's calling substance misuse now.
Okay.
Oh.
It was a productive meeting that was held, and I had with reports and updates from Jenny Ebert, Shelley Williams of Community Corrections, and Julie Gibbs of the Health Department. The 2023 report and recommendations document was handed out and discussed. It had in it the 24 goals and outcomes and recommendations, and that's needed to be completed and discussed. So it was a fairly productive meeting. I was impressed with the good discussions that came out. It's getting the formulation of that committee. Wednesday afternoon, I spent some time here in the office going over today's meeting and documents and working on a handout for Monday's meeting of the county officials. And then that's it for me.
Ready for business, commissioners?
Yep.
First item we have is I need a motion to approve change order number 1 with Ebert Construction Company Inc. for Flat Rock Road Culvert Replacement Project, the amount of $7,968 for an adjusted contract project, $222,980.82.
Oh, that was a lot.
Yeah, so this amount was not included in the original quotes or
Yeah,
what?
the quantities weren't included in the plans. So KDOT sends out standard plans and they just weren't populated with quantities.
Nobody caught that before.
No,
Would that have made a difference in the choice of the contractor?
I don't think so. No.
None of them would have had.
None of them would have
Oh,
had
it
it.
wasn't in there. None of them. They said use the numbers that were in there.
Huh.
Good.
Okay, that's. Any other questions on it?
Their way of making that up along the way? Some of it?
Making it up. As far as the project costs.
Yeah.
There's possibility, it just depends what all goes into the culvert and what doesn't. The quantities that were, I guess, spec'd out for that soil saver, we actually ended up putting in slightly less than that. Just with how it was constructed.
Okay.
So there's always a chance for using less quantity in the project.
Okay. All right, so I'll go ahead and make the motion to approve the change order in the amount of $7,900 and $7,968.
Second.
It's been moved and seconded to approve the change order in the amount of $7,968. All in favor?
Aye.
Aye.
Sure, please sign. Next, commissioners need a motion to approve the agreement for the interim bridge inspection 2023 with Schwab Eaton, PA, in the amount of $2,100.
Just their update. How many bridges do we have?
So we only had one this year. It's a
Oh.
fracture critical bridge, one of the truss bridges.
Okay,
So this
like I said, I didn't think it was that. I mean, we've got a lot of bridges.
now, so last year's was the biennial, this is just the interim, so.
Oh, okay.
More, I guess, actually the ones in worse condition.
Oh.
Special.
Yeah, okay. Oh, okay.
Moved and to approve and sign the agreement for the interim bridge inspections 2023 with Schwab Eaton in the amount of $2,100.
Second.
It's been moved and seconded to approve the and sign the agreement for the interim bridge inspections with Schwab Eaton in the amount of $2,100. All in favor?
Aye.
Aye.
Some of these pages, all of you sign, some of them just the chair signs.
Oh, wonderful. Okay. Let's see here.
First, think of any items for the joint city county meeting.
What's on it right now? Yeah.
You know, it looks like they already put out an agenda for it though.
Yeah,
Yeah, there was a couple things. I forget what was on there.
Yeah, I've got it here. in a second.
one was, I
See it
think Jenny
yesterday.
Ebert was.
Yeah,
Yeah, Jenny Ebert, correct
And
one.
then the East Gate, Manhattan Gateway,
All right.
which, you know, doesn't really,
Well, that's Pop County.
yeah.
Wanted to make some money to
They
that.
show,
No,
they show up.
Isn't the Gateway 177?
No.
That's
Isn't
one
that-
of the gateways. That's one of
Oh.
them. Yeah, it is
The
one.
East Gateway is the.
But the east is Pop County. That'd be the south.
And just as a reminder, that's not at City Hall, that's gonna be at the,
Yeah, so, the new building.
yeah,
Yeah, I've never been there. I don't.
probably the point.
Show that building.
Yeah.
Here you get the buzz, you get in the door.
Yeah, I don't
Really?
know. I know.
I've been out
I was
there.
thinking that too.
I've been out there, yeah, but it's working on getting the barricades lined up.
Bless you.
Can't even get in the door.
Must be some- You can hear this getting to me. Too much.
All the commissioners want to attend Good Morning Manhattan on Thursday, November 16th at 7:15.
Yeah, that's fine.
Greg,
Yep.
bless you. Catherine? Like the 10.
Coughing.
All these signatures.
All the leaves fell off the trees, so
That's-
there's pollen everywhere.
That must be what it is.
Would you like to attend Good Morning?
Yeah.
Clancy?
No, thanks.
Do we have an agenda on what's going to be presented there?
Yes, it is a famous person, actually. Anna
Yeah,
Burson,
that's what
not
I
the county appraisal.
Okay,
She left us.
he's getting pretty famous in the county. Is
I was gonna say, under the county appraiser, I don't know the famous goes along with it.
She's not even here to defend herself.
Yeah. I know. They're all our signatures, so I think. Not everybody.
They like stacked together.
Okay.
You hear comments yesterday from one of the election workers about how the new system, thought worked very great. People were commenting,
Yeah, we've had a lot. That's what my advanced crew said, and how many favorable comments, just like Catherine had made, about it.
Chuck Canfield, he's one.
Mhm.
He was saying that thing went so well.
Yeah.
Even the people came in questioning what it was doing.
Mhm.
That was just all great. Oh, it's,
Mhm.
Yeah, they were really good at explaining how to do everything, which was good. So, they're trained well.
That's because, Susan and her staff do an amazing job on training. They did 20 some trainings.
I seen
Well, I know several.
At least 3 of them myself, yeah.
People in here.
And since there's so much new stuff, made a lot of them go through it twice, because a lot of change this year. A lot of change in security procedures. We had to go through.
That's the I've never seen them.
Yeah.
You missed one in here too, Greg.
That missed one.
I probably did too, for the record.
Those pages are stuck.
Yeah.
Oh, they are. So I was sneezing, I think. Sometimes it gets to me.
Okay. What do you think? You can check it. Let's see.
Yeah. I may have missed that.
Cindy catches them all for all of us, that's for sure. Any changes to the minutes, commissioners?
I didn't have anything.
I didn't either. Okay. Go ahead and then make a motion to approve the minutes as written from the November 6th meeting of the Raleigh County Commission.
Second.
It's been moved and seconded to approve the minutes from the November 6th meeting of the Board of Riley County Commissioners. All in favor? Aye.
Tentative agenda is okay, commissioners?
Yeah.
Any items for next week's press conference? Tentative commissioner, I will be on there. We're going to change the canvas date from November 20th to November 16th. We're moving that up, and it's going to be a standard process we're going to change because, as we know, with the last election, there's more and more chances of recounts.
I have.
So when there isn't, people have to file a recount by the next day. So I do not want to take the risk of making staff work over Thanksgiving any year. So that's why we're doing that.
It's on the 20th.
Well, on the 20th, we're moving it to the 16th.
Oh, the 16th,
Yeah.
okay.
3 or 4 5 is in the last position of the bunch, just 1 or 2 votes apart.
Yeah, I don't know what's gonna happen there because the gentleman that passed away over the weekend got number 3.
Oh, really?
Yeah.
Oh, I didn't see it.
But that's for Ogden City Council to figure out.
Okay.
We certify the top 5 vote getters.
Yeah.
Anyone that cannot take the oath for whatever reason, then it's up to the city council to determine how to
Go to the next one.
approach that.
When do you have all the write-ins lists?
The write-ins, we'll be having the write-in board. I think they're scheduled today or next week early. And then we'll have the provisional board after the canvas. And so we still have a few more things that, of course, we'll receive mail-in ballots through Friday, as long as they're postmarked election day. And we'll count those last ones for the mail on Monday. So the totals will change all the way through Monday for Riley County.
We've got
And then we got the provisionals.
we got a couple races that are close enough.
Yeah, one got a little more of a cushion yesterday, went from 20 to 33. So we'll see. We'd still have 500 mail ballots out, but a lot of those are permanent. And you can figure about the same percentage is going to participate, and maybe we'll get 20% of those back. So
Obviously, because I'm Riley, I'm city Riley. We go to the write-ins to fill in if there's a vacant position.
Yeah.
Yeah, there's probably, how many does it take really one write-in? There's only, or does it take 5 votes?
We just went, no numbers, just whoever had the top write-in one, they talk to them, and if they don't want it.
Yeah.
So commissioners, you have Mr. Holman's executive session at 9 o'clock.
That's it. Riley had one. So over here that had one position there, 4 people, same number of write-in votes. And they contacted and 2 of them said, I'm not taking it. So they had to come in here and have a coin flip to decide which of the other ones, which way they got.
I went flip not too long ago for the Manhattan City Commission too, didn't we?
Jamie Morris Hardman and Jim Sherrill.
Yeah.
Oh, right. I mean, it's been a while now, but
Yeah,
We had one for county.
I was back in the
that was, it's
19 or
atypical
15.
for a bigger
Yeah.
election,
That was like 2010 or something.
Yep, remember that one well. That was a big discussion on clerk's listserv yesterday. So many new clerks. Some of them had some ties and were asking, well, ties at the time because they can still receive mail on how to handle those. I've flipped many coins to decide a race.
My question, do you have a special coin for that? Shh.
All heads are all there.
Yeah,
Yeah.
that was gonna be my follow-up question.
You gotta keep this out here. So, yeah.
Corey has that effect on people.
I mean, he's not doing anything in here, so I'm gonna send him to do some work.
Oh, okay.
Good idea.
Fair enough.
Thanks again for all you guys do.
Oh, no problem.
Appreciate it.
Absolutely.
Clancy, you want the full time?
Yes, please. Thanks. Rich.
Yeah, Jones was kind of grumbling to go. It's an hour or a half hour late.
Yeah.
It'll be 20 minutes. 20, sorry.
How long will we give the funding
Well, tell you right.
public hearing on the 16th?
Which public hearing?
The one for Keats. So as it starts at 11:05.
It's 11:05 through 11:35.
So 30 minutes.
If you want longer, let us know. We just have David Adams for a staff update right after that. So if you want longer, let us know.
It's
Could be
probably
a while.
long enough.
Depends on how long you want to get chewed on.
She'd be a participant in the
No.
executive.
Now feel free to toss her out of there.
Ready, commissioners?
Yep. You didn't have anything else?
No, sir.
Okay. I'll go ahead and move that the county commission, including Chairman BOCC, Vice Chairman Ford, and Commissioner McKinley, recess into executive session on potential litigation for the purpose of consultation with Clancy Holman, County Councilor, Shelley Woodard, Deputy County Councilor, attorneys for the commission, which would be deemed privileged in the attorney-client relationship, an exception to the Kansas Open Meetings Act, and the open meeting to resume in the county commission chamber at 9:20 a.m.
Second.
So it's been moved and seconded for the Board of County Commissioners to recess into executive session until 9:20 a.m. All in favor?
Aye.
Aye.
Thank you, Commissioner.
And that, thank you. Previous thank you.
Absolutely.
Assuming number 3.
Yeah, exactly. Actually, yeah, it is 3. You got it.
We're live.
Okay. I move that the Board of County Commissioners come out of executive session.
Second.
It's been moved and seconded that the board come out of executive session. All in favor?
Aye. That me?
No, it's Corey.
That was me, like I said, so we always watch it on here to make sure that when you were an executive, there's.
That's what I was saying. That sounded like me on the phone.
Oh, gotcha.
Yeah, no, I got you.
I thought you,
Well,
I thought you were worried about it.
Well, now I'm gonna charge you double for that.
Well, we're gonna get it.
Do we get a second on that? I'm sorry.
Yes.
Okay. Okay. I'll go ahead and also move that the record reflect no binding action was taken during the executive session.
I'll second.
It's been moved and seconded that the record reflects that no binding action was taken during the executive session. All in favor?
Thank you, Commissioner.
Not used to hearing myself on somebody else's. That'll weird, yeah. That threw me off.
Next, Commissioners, it's time for Brittany on monthly cash flow reports whenever you're ready.
Okay.
Good morning, Commissioners. Brittany Phillips, Budget and Finance Officer. We have the monthly cash flows, and we'll start with economic development. Nothing has changed since last month. We did not bring in any extra revenue. We have not expended anything. I'm gonna make this smaller so you can see it. And your unencumbered cash balance is $340,085.60. Your county building cash flows for October, we received $4,832.69. And we spent $6,575.53, bringing our total unencumbered cash balance to $204,937.40. Thank you.
Yeah.
CIP. For our total revenue that we brought in October, it was $203,876.32. Expenditures, we had our normal expenditures as well as encumbrances, bringing our total expenditures to $238,676. And our ending unencumbered cash balance at $13,202,554.20. Estimate sales tax cash flows. We had KDOT reimbursement for $1,905.58. And again, we had to expend our normal expenditures and encumbrances, bringing our total expenditures for October to $34,805.12. And our total unencumbered cash balance is $6,911,556.40.
Minus 8,000 from this one.
Yeah. Yeah, they'll get updated.
Yeah.
And then the 0.2% sales tax cash flows, we brought in $223,209.72 in revenue. We have not expended anything out of that money. We have brought in $1,686,999.35.
It's not real bad considering we started in March.
Yeah.
Pot County got bad news on theirs.
Sure did. Overwhelmingly bad news on theirs.
They did
had
pass.
That sales tax 0.25 on the ballot.
They didn't pass.
Oh, really? Lost almost by 56%.
Do you guys have any questions on the cash flows? Perfect.
Thank you, Brittany.
Thank you.
Thank you.
Next, Commissioners, you saw the email yesterday, Shiloh,
Stuck somewhere.
not attend. So, we did try to shuffle it around, but Julie had a conflict, so she couldn't make it to fill in for her, and thought she would need more time as well, so
And
we did try to
Jason,
shuffle it last minute.
Jason couldn't do that.
Yeah,
We've got until 45.
9:45.
Okay.
It's kind of hard to adjust things. We get notified that late.
Yeah, where she's stuck at.
I do not know.
I just said she was supposed to get into Dallas and a flight was off or something. She wouldn't get to get it.
Anyway, she said she wouldn't
Wouldn't get
get
that flight till
early
early
in the morning.
Yeah, she would
The first flight out of there was like 6 a.m. or something back into here. Sometimes I
Yeah,
catch
that's the
it.
trouble with going, flying in and out of Manhattan. You just never know if you're gonna get on the connection. Plus, when I was booking my flight from here, it was like $1,100 more. To fly in Manhattan. It's going to, yeah.
Well, it's always been more. But I always figured, well, but it's cheaper. There's no parking fee now here. Now it's parking fee, you got to pay to park them here too now.
Wait a minute, it wasn't 1,100, it was 1,100 was the cost
Oh,
as compared to 5.
oh, so it's double.
Yeah, it was double the price, and I said, I can drive to Kansas City for that.
Yeah. Unless you get really bad gas mileage.
No, nothing like that. I mean, I feel like.
Drive my old pickup.
And the parking, out parking isn't that bad, that's what I'm saying. You take the whole shot.
Yeah. So let's get they play again. The basketball parking lot. Really? That'll be whatever that heck that is. Someone that should be able to beat up on, yeah. I assume like this, not even ever heard of some different. Be curious to our football team's reaction, response, Yeah. That'll really determine the score, their attitude. I think it should be worse than that. If we're on our A game and focus, but. Well, Baylor in one spot. Fire them had big. Then they had their one spot, they get it together. They dropped 2 years from being the championship game. And I have. That volleyball team, when they go, I mean, if you need to go watch a match, I mean, girls are athletic, they're fun to watch. Volleyball is good. First problem is I watch too much middle school and high school volleyball. Middle school volleyball is all at the highly competitive level. I think it'd be good like that. But also, it seems. And I've seen a few, we've gone to a couple of college ones, well, and it is, I mean, they're amazing, yes, I mean, they can jump out of the gym. But it's a momentum game. Yes. If somebody gets bowling, there's a psychological, it looks more than any other, I mean, in basketball, all games can be that way, that I bet it just seems. Especially the women's game, but just game, somebody gets the goal and then the other one just all said, I can't get anything by. Yeah, no, I agree. There's nothing like volleyball. And my kids in sports to watch at least favorite, especially because they always had matches on Saturdays. It's like, oh, the heck. Even in high school, it's like, the heck. Was huge ball. It was coming that great that was. It's a lot of basketball. People who are looking to well, they said when they were talking about being on the radio swim, so it was sold out. I said all of them have been selling out. Oh no. This is buyer taking out, but they've all been selling out. 3,000. That's impressive, yeah. Move the joints around.
Yeah. Not excited.
I've been having that. Finally, hey, first of this week.
I started doing, got myself one. My radio size.
I emailed my PT daughter at Oklahoma and said, give me some sciatic stretches, so she sent them to me.
Yeah, I've done, and I didn't get that done yesterday. I didn't get the stretches done or the bike, and I've been doing that all week in that house, but. Then you give me some injections.
I got back.
And I guess it's something that happens.
Narrowing the spine, generate disc and
Mhm.
Well, yeah, it's for those. It's that. Holding this. He's on the. First, well, he had been on St. Louis with injections and stuff. But they told him he was, and he's saying he is a candidate in surgery for his, because of other problems, another business. He's a. Maintenance worker. Dollars there. He didn't say, but he also said. You know, weight loss program. He wasn't really, he was big, he was huge. He was. Big.
Surgery.
You can talk about it. Yeah. Yeah. Good.
I've been going to this. I've had one. They gave me 4 injections. Yeah. Well, they're gonna do one in the spine, and then they're gonna run the kid, do one in the neck. I don't know if I'm going to do it. That's what I do.
Yeah.
Well, he just said, lives out, I don't know.
You know how well that works.
Our phone, he said we know some, responding to him, but he never got my responses.
Yeah, I got the call, but I didn't get voicemails, and I didn't even get texts. He's got them. He got them on his phone. They just aren't on my phone. That's weird. Yeah, it's very strange. I don't know. I'm gonna say Sun's box.
Yeah.
Yeah. I have AI is in my phone.
Oh,
Because it sends stuff to people that I don't even know, you know. I didn't say, no, that's, yeah,
No.
but I mean, I was working on something on my phone. And I was trying to print it, and instead of printing it, it sent it to my friend Steve. I sent him a message, like, ignore that one.
Don, he would talk to me, he said, he typed out a big long email for me. You couldn't get it to send, said somebody had to set up an account to send it to us or something.
They're one of these cows.
That's the way he got into. No, he don't even. Yeah, said it's correct, but it's not. So he didn't mess up, so.
But I will send out, I'm gonna send you some text. I'm gonna follow up with all
A piece of paper.
Just so we make sure they get them on their calendar.
Yeah, and they're the same as what you gave me, right?
Keep that, all the. Department reviews. Which you've got. Stacked up and sent. No, I figured it's the day, it's the real day. No, it's one of my thoughts. That's what I think the real. I do, it's the night on there's something there with, but yeah.
Again, that's something, again, that's intensive. Because I mentioned, sure. That's
the last of the first days. Yeah, but I told you that before, okay. Multiple kids are set, or in week. December 28, 29, January 1.
On some level, that's okay, because it's a taken care of.
But it was an expensive time of year.
Yes, it was. Particularly when they're little.
Yeah.
Yeah, they just.
Yeah, when they were wanting all the latest gadgets.
January 4th. We get an executive session.
I'll be there.
Okay, I'm gonna see what I got and what it means.
January. How much January?
And so we and I'll get back. I don't have any ideas. I'll see it this time. If not, then that would want people to pencil it together. So that's. So I don't have much of a month.
No, there isn't much left of it.
Yeah, all of our.
All this evaluation, that's.
We just didn't time on it.
That's what, bring that go up, for instance, yeah, some kind of question, because Bob was running the. Running for the show thing, and said something, he said, and he said something, and referring to me, say, and very glowingly referring to me, and everybody there knew, what? And I said, evaluations are coming up.
He's no doubt. He knows what's going on.
Yeah, I was really planning to go to that meeting that night, but after the meeting, I'm not gonna go.
So like I say,
I'm just doing that.
yeah.
No, that's good. It even.
Does it really?
Yeah, only when it's not supposed to.
Only when you say something you don't want to hear.
So they've done that specifically the purpose.
Yes, writers all for it. So sweet, pretty lonely.
Is that how it is there? Or for spreaders? Oh, something else.
American time and ego. Ego is actually right. Should be a sphere. It's a couple of things I learned about books.
So I highlight that flag.
Yeah.
Like started out outside of the experience as a classic texture. There goes a little bit. For a while.
Go to Grandma Dillon's house to get my big goods for her. But who knows?
Yeah, so those would get taken into more like that, right? Take over to the.
Yeah.
Melissa makes some stuff. Before she left town, and that part of the last batch was moving forward, so I'm gonna make some of it, and they just have a big price. Yeah. And they just have a one chocolate pop, this was swims in bags or something like that.
Like I said, I always cheated. Like I go get, well, I would say since you're all been in post, like I used to like make pecan pies and like go all out, but now I just go to Dylan and get those bun cakes and then I'll like redress them.
Just for enough legs in Boston.
Okay, great. Why not?
You can't do that.
No,
And that's why I didn't answer back to it, so I'm like, I'm just thinking about turning it over and it's not gonna be worth the band, you know?
Going to talk to Rick.
Yeah. Morning. How's everybody doing?
good.
Good.
I'll say ad hoc. Make sure I follow it.
Okay. So then I got to see last night. When case statements.
For what?
Like you say, when it's like.
I look at it.
Yeah, it's
Was it here?
Mhm.
Yeah, but I heard something on the radio about this, and I didn't, and circle back around. See what happened.
Some folks said when I left the business with
We're in the strange.
Somebody from the Collegian, I think she's got her channels mixed.
Yeah, I know, I got a message from Montana or.
This is somebody else, yeah,
Talk to her.
I did talk to her.
Okay,
yesterday,
good,
but
because I just got this.
This one is saying she wants a new picture of the new county commissioners. That's news to me.
Oh, I was gonna talk to you at the end of the meeting.
Huh?
I was gonna talk to you at the end of the meeting.
Oh. Oh, boy.
Do we have an election we didn't know about? I was gonna email you today. Like tomorrow's.
And then
Veterans Day. What time are we supposed to be there? I haven't gotten anything on.
And so this parade starts at 9:30, so even if you get there at 9:30, we'll have a seat at the green. Yeah. So, yeah, and then the ceremony is at 11, so.
Okay, I was just making sure that.
So, but yeah, I figured, because I think by the time they get to the grandstand, it's almost like 9:50-ish. So,
Hopefully it won't be as cold as it.
yes, if not, I'll have blankets.
I don't think,
Last year's pretty cold.
it was pretty cold in the morning, but I think it'll be.
Yeah, I think mornings, the next couple mornings supposed to be pretty cold.
Yeah.
We're just talking along over here though, 38 or 39 tomorrow morning, it started the parade until 20 degrees warmer than it was last year.
Yeah, it's nothing could top 19 where it was like 5 and it was just blowing snow right from the north. We couldn't even get the fire engine started. We had to ride the fire engine 3, I think that
I was telling them walking over that in 19, I went outside for about 20 minutes and I literally felt that I went back and said, I should be staying out here for the kids.
Yeah.
Cause and
I felt so bad for the horses because they still had them out and they were just, they were so frozen, poor things.
Yeah, that was well.
Yeah.
The low tonight's 29.
The biting going snow didn't do anything.
Yeah, it's gonna be cold tomorrow morning.
Got like cold, dry snow.
That was.
Man, I got my fur coat.
There you go.
Oh, God. Sorry, price wrong thing.
Nothing warmer.
No, I've got a couple really nice fur coats, but I never usually get to wear them in this weather. You know, usually winters haven't been that bad.
They were saying yesterday, the forecast was supposed to be like 38 at 9 o'clock or 9:30 when the parade started. It's just been worse than that. Something
Yeah.
raining.
I saw some already. I've got some nice warm. boots.
It is time.
Okay.
Ready, Commissioner?
Good morning, Commissioners. Harris Holden, Director of Economic Development at the Manhattan Area Chamber of Commerce. Thanks for having us this morning for our monthly update. I just wanted to highlight the Chamber held their annual board retreat, which we did a little different format this year than we have in the past. No longer program included, in addition to the board of directors, included an invite to committee members. Appreciate Commissioner Ford participating as the ex officio representative on the chamber board for the county commission. So thank you for participating in that. I think it was a good discussion. Three key items that I want to highlight coming out of that board retreat as priorities moving forward related to economic development. One is continuing to pursue solutions for industrial and business park expansion, and belief that's going to be essential moving forward to ensure whether it be growth of existing businesses from within the region or attraction of new business, that's going to be a really important component is to do that expansion, including infrastructure development and everything else. So number two is housing, and I know you all hear that from a lot of different directions on a regular basis, but understanding that the need for additional housing inventory in this broader market, the impacts that has on the ability to recruit and retain talent, and the ability to generate additional housing opportunities as folks move up within the housing market are all important. So looking at various different programs, whether those be at the state level or otherwise, various different programs that could be utilized, and we'll continue to work with the county and other partners to have those conversations. And then third, childcare, another issue that significantly impacts workforce. So we've updated over the course of the past year. There's a lot of effort that has gone on. It started with a childcare task force several years ago that the chamber put together of partners across the region. There's been some success working with the Greater Manhattan Community Foundation on applying for some state grant dollars to help develop a childcare accelerator program where businesses could come in, providers could come in, they're interested in getting into childcare, get resources, space, and otherwise to help start a childcare business, and then utilizing those resources that should go brought into the community, and then others come behind them. So that initiative within the overall childcare umbrella, or under the overall childcare umbrella, is the one that's really seeing some progress. There's still additional funds to be raised, but the Greater Manhattan Community Foundation has been very active and a great partner on that effort. So those are three key items. We'll continue to update. If I hear monthly from us on those, you'll see that as our end of the year report that we'll provide you, and we'll have additional information there. But looking forward into 2024, that's really a key area of focus. So with that, I'm happy to wrap up answering questions. I'm trying to also move along as well. Our account strategy manager, we introduced her last month, but she wanted to update on some kind of key initiatives that she's working on the talent side before Christian talks about military and Veterans Day and a lot of other things coming up. So.
Good morning. My name is Allison Muth. I'm the Talent Strategies Manager for the Manhattan Area Chamber of Commerce. Just wanted to give you guys a quick update. We're rounding out our career fair season. We currently went to the WIPW Community Career Fair, as well as had a Made for Manhattan booth at our first annual Emerging Leaders Summit, which was 110 young professionals in the area who had gotten together for a day of professional development. So they got to see that Made for Manhattan resource available to them, and Jason Smith presented that. And we finished Tuesday, with Fort Riley. We had about 300 participants on base there that came and saw the Made for Manhattan resource. Being new to my role, I have been visiting businesses, building relationships, and just understanding what challenges businesses are facing. So if you come across a business and you hear challenges according to workforce or talent, please let me know. I'd be happy to speak with them and learn a little bit more about what they're going through. But so far, I've visited Manco Window Systems, Manhattan Area Technical College, Florence Corporation, Box Home Innovations, Community First Bank, and No Stone Unturned. needed. So through those efforts, I've come across a couple of challenges, one being apprenticeships and internships within the area. We are going to get involved with the Kansas Apprenticeship Program and be an intermediary in those efforts. So being able to fill out the paperwork for them and making sure they have those resources. As well as putting together an internship toolkit. A lot of the organizations that we come across only have 1 or 2 HR personnel and they don't have the capacity to build those resources. So just building those resources for them and being another partner in their guide to do those things will hopefully keep individuals here in the community as they're leaving college or leaving their secondary institution. The last thing that we're currently working on is building a strategy for LinkedIn and Handshake, 2 very large recruitment platforms. A lot of the organizations, we do a really good job of building resources for higher education and getting those students to stay, but where are those 3 to 5 year experience people coming from? And so that's really where we're going to target now. And then lastly, Christian and I went to Boots to Business, which is a initiative on Fort Riley for participants leaving the military to understand the step stages and activities for launching and growing their own business or finding employment in the region. So that's currently what we're working on, and I'm happy to answer any questions. If not, I will pass things off to Christian Bishop.
Are we doing anything for National Apprentice Week?
So yes, that's next week. They are having a summit, so on Tuesday next week. So if anybody's interested, you can also go to that.
Okay.
Good morning again. We're at Christian Bishop Military Relations for the Chamber. And so before I start to talk about all the Veterans Day activities, I just wanted to talk about last week we had the Veterans Day Small Business Summit. We had over 60 small businesses register for this Flint Hills. And this event just featured an introduction to the newly formed Flint Hills Veteranpreneur Foundation and had a panel of veteran entrepreneurs and also veterans sharing their stories, sharing their successes, sharing some of the things that they've struggled through. It's great to just get a whole bunch of organizations together to just go forward and just know that they're not alone, know that there's resources. So we had, it's 1 of 4 summits that we're actually going to do in partners, and there's a lot of partners, but I wouldn't be remiss if I didn't mention all of the work. So the SBA, SBDC, Spark MHK, the Junction City Military Affairs, and Main Street's Vet Biz and SCORE. So like I mentioned, we'll do 4 summits, 2 here in Manhattan, and then we'll do 2 in Junction City. And then at lunch, we had a conjunction and we allowed the Veterans Entrepreneur Foundation to speak to let us know what they have been doing for the last year. And it's just great to see a group of individuals that started off as a coffee, just getting together, are now in the process of getting their 501c. And so they released their 3 core missions, which was advocacy, community, and training for our veteran small businesses. So that was just a great segue into Veterans Day. And as you know, we kicked it off on Monday with Chair Hokie proclaiming this week as Operation Greenlight. And so from November 6th to November 12th, we have lit in the area green. We will continue to light up the county green. I was in a meeting last week and there was actually a couple counties, Potawatomi and Gary County, that were asking how we got involved. And so I've been sending them the information. And of course, so much kudos to Commissioner John Ford for taking the initiative and bringing this to our county. And so, as you guys know, tomorrow starts our Veterans Day celebration. And so this year's theme is Veterans of the Cold War. And so we will kick it off with a breakfast at the American Legion, where the Knights of Columbus will be cooking up biscuits and gravy, which I think is the perfect way to warm your body up before heading to the parade. So from 7 to 9, you can stop at the American Legion. And then the parade, which some say, I think they are right, is one of the largest veteran
Veterans Day parades in the state of Kansas. So starting at 9:30, it'll start at Manhattan Town Center and then it'll end at City Park. Commissioner McKinley was there. We started with 62 parade entries, and even just yesterday, I got 4 more parade entries. So I think we're up to 66 and we'll have almost 1,500 participants in the parade. And then after the parade following, we will have the Peace Memorial at the Peace Memorial Auditorium. There will be a ceremony of honor and the guest speaker will be Brigadier General Bill Turner, who is the director of the Kansas Commission of Veterans Affairs. And so I will just send you guys an email, and those of you that would like to, I apologize for that email not getting to you guys earlier. But for those wanting to attend the parade and the ceremony, I'll just shoot you guys a note and just let me know if you're attend so we can ensure you guys have seats. And then last, we will end the week going on a bear hunt as K-State football hosts the Baylor Bears for Fort Riley Day. So tickets were distributed to soldiers and families, not only at the travel office on Fort Riley, but also at Briggs, and they were gone in 3 hours. So it's pretty exciting to see that soldiers are excited to come watch K-State. And so it'll start with, they will have the recruitment there over in the practice field. So they will have some static displays, also just different activities for families to participate in. But we will also start with the flyover, the command team running out on the field. This year they're doing something different. They're doing a flag presentation. So we will have a massive flag out on the football field. The 1ID band will be performing again with the K-State band. And then General Retired Funk and his family will be being recognized at the game as well. So for any and all activities concerning Veterans Day, I just ask everybody to check out the Manhattan Convention and Visit page. So it's www.manhattancvb.com. So without any questions.
Just wanted to point out, we need to make sure Baylor fans understand that downtown's great for a different reason.
Yeah.
It's true. Yeah.
My goal, I'd love for the stadium to be green, but I was like, I can just see the state fans. So I think that we were.
Maybe not this year, maybe another year.
Yeah.
So, thank you guys again.
Thank you.
I've got one last thing really quick, and then happy if there's any questions. Just wanted to remind you all that our Good Morning Manhattan program, which is next Thursday, November 16th at the 7:15 a.m. 4 Points by Sheridan is the Riley County Appraiser. So I appreciate Hannah coming and speaking to that group. I know that's had good registration so far for that event. So really do appreciate her coming and talking to that chamber group as part of that program. So any questions on anything we've reported on this one?
Thank you.
Everyone, commissioners, appreciate the time. Have a good day.
Thank you. Next, Commissioner, we have Julie Gibbs at 10 o'clock. There's Julie and Jake. Good?
So Christian said she was talking to the mall, see the way that green one said, you know, you got the.
Yeah.
I didn't think of the green with Baylor.
I thought about the other night when I drove down there to take a few pictures. I thought,
Oh, man, timing is everything.
Yeah.
They're gonna go, look, they support us.
They'll
probably get all kinds of kudos. Boy, Manhattan really welcomed us. They had green lights everywhere.
Which is fine for them, but then every team will expect colors. So
It's a good thing we don't have our previous health director at this time.
Oh, I know.
She was
That's
a
right.
huge Baylor fan.
She graduated from Baylor.
Okay.
Yeah.
Yeah.
And she was always talking about Baylor.
Uh-huh. Oh, yeah, her and I'd rib each other pretty good on that.
I do remember that. The year they won the Big 12 championship and the women's team
Mm-hmm.
tennis championship,
That
and
was
the baseball team made
That
it
was
to
for
the
the stomach.
World Series. Yeah.
Information in the bill, is it?
Is that right?
He's been here for quite a while.
Yeah.
put the green light on the front porch. Why, there's a porch, the ceiling's up here, there's a beam across the porch down here. Can't even see.
Oh,
Can't even see
shit.
it shades until you can't see that.
All my windows kind of blocked from where you're seeing, so I don't know what to do on mine.
I thought, well, I put it up there, and then I drove by and went, oh, did they burn out already? No, it's there. You just,
Yeah,
unless you're
there.
standing on the porch, you can't see it because the
Mhm.
fixture's so high up.
Ready, commissioners?
Yep. I have to make a motion. Motion that we recess as the Board of County Commission and reconvene as the Board of County Health.
Second,
So moved and seconded that we recess as the Board of the Commission and reconvene as the Board of County Health. All in favor?
Aye.
Aye.
All right, good morning.
Morning.
I'm here with my monthly report and joined by Dr. Clark. He'll follow my presentation with more details on the clinic update. But first, I'm going to start with expenses and revenues that Shelley's provided to you as of right now. Any questions on any of that?
I like your new chart.
Yeah, I like that too. A lot better than the Excel sheet.
Yes.
Yeah.
A lot
And
better.
you made it in purple, not green.
Yeah.
Oh, wait a minute, there's
Yeah,
a green one,
there's
never mind. That's what you said.
Scroll down, yeah.
Yeah,
She said.
and here it's blue.
Looks like Christmas colors there. All right, so I'll go into program updates, starting with the maternal child health program. NCH held all of their Becoming a Mom classes on Thursdays in the month of October. They had a total of 73 class participants. Additionally, they held their Becoming a Family classes with 12 participants. The bilingual navigator Maria taught Spanish BAM class and had 19 Spanish speaking participants. She also gave them a hospital tour as well in the month of October. The perinatal yoga class, as part of the Perinatal Community Collaborative Health Equity Opportunity Project, was held 2 out of the 4 Wednesdays in October due to the yoga instructor being unexpectedly unavailable. But they still had a large number of participants. They still had about 20 at each class. Safe Kids Riley County, along with the MCH program, submitted their final report for the KDHE Injury Prevention Mini Grant, which provided CO2 detectors, baby gates, doorknob covers, and cabinet and drawer locks to MCH home visiting families and Life Choice Ministry clients. Additionally, funds were used to purchase educational signs and materials to hand out at the Laundry Love event that they hold once a month, where we send a Raising Riley representative as well as information from MCH. And this is to reduce poisonings related to laundry detergent in pods. MCH plans to apply for the 2024 KDHE Injury Prevention Mini Grant in November to purchase pack and place for first responders to provide to families in need when responding as an extra touch point to ensure safe sleep environments in homes. MCH staff will provide education and training to first responders as needed. They also plan to apply for the Greater Manhattan Community Foundation funds again in December to host their 3rd annual community baby shower taking place this summer. Childcare licensing has been very busy. They have all of their surveyors back on now after being on for maternity leave. So they have made a total of 44 visits in the month of October, most of those being in Riley County. They're currently investigating 8 complaints and working on 6 initials. Heather met with a local home provider and Melissa Schoenberger, who's the KDHE Director of Systems and Field Services, to discuss how to build partnerships and connections. It was a good meeting overall. She also attended the mental health assessment meeting and presented at the Emerging Leadership Summit. The proposed new regulations are currently sitting at the Attorney General's office, and they'll continue to move through that process. We just don't know for sure when they'll be out. KDHE is also rebranding the term surveyors to licensing specialists. So we're changing all of our documents over to now say specialists instead of surveyors, since they do a lot more than just surveying. So we've already made Elizabeth aware and we'll get to working on that. And this is a facility report for the current month. As of right now, we are down providers in Riley, Geary, and Dickinson counties, no change in Clay County, and we're up a provider in Pottawatomie County. This is a decrease of 2 providers in the region. That makes a decrease of 14 in the region in the last 4 months. So it's not as many providers that were down this month, but we're still moving in the wrong direction. So we'll continue to investigate that.
Raising Riley has been very busy as usual. They had their last class with the MARC participants, that's the Manhattan Afghan Resettlement Team. For health literacy course, they had 9 participants and 8 children. They provided information to 5 adults and interacted with 9 children at their Laundry Love event on the 10th of October. And they held an emergency preparedness for childcare providers on the 7th of October with 7 family childcare providers in attendance. They also partnered with WIC and the clinic to do outreach at Bewitching West Loop on Halloween, and they interacted with over 200 people, I believe. There were quite a few trick-or-treaters out that night. So WIC has been busy, as usual. They've had multiple outreach events throughout the month of October, including Oktoberfest, the Trunk or Treat at Fort Riley, and Bewitching West Loop on Halloween. They also hosted WIC staff, KDHE WIC staff, Amy King, who's the data and systems manager there. She was able to observe and talk to staff about technology and practices that can make work more efficient in their environment. The WIC staff also attended the Kansas Breastfeeding Coalition Conference in Wichita on October 26th to review hot topics in lactation. And this is a picture of our WIC clerks, JJ and Debbie, at one of the Halloween events. And then last but not least, a FEP update. Skylar attended the Howland Prowl on October 22nd at City Park. They distributed information pamphlets on zoonotic diseases and how they can be transmitted to humans. They received 140 survey results on the public's knowledge of zoonotic disease. They also hosted the ESF8, that's Essential Support Function, tabletop exercise this past Tuesday in cooperation with Riley County Emergency Management. So Skylar and Baldwin and Lori hosted this, and it was very successful. When I peeked in, they had all 3 tables were full, so maybe 15 or so people that were there. This is to help local health care facilities, nursing homes, and rehab centers develop their COOP plans and be more prepared in case of a disaster. And this is just a quick update. Sorry for the writing there, you can barely see it, but on grants, we do have our MRC, that should say unit leader. We switched that to unit leader. It's a part-time position for the next 2 years. We still have that available. We have 3 applicants so far and 1 interview that's scheduled. And we're still looking for a DEC coordinator. DEC is an acronym that stands for Drug Endangered Children of Kansas. This is another part-time position for the next 2 years. This was a grant that we received a while back. We have conducted 5 interviews. We have 5 more scheduled for next week. So we still have that open. And we actually have had more than about 40 applicants for that. So quite a few people have applied. And this is some information on the mentor program. I brought this to your attention a few months back, but at that point I didn't have as much information. So I wanted to update you on this. This is being offered through CKF, that stands for Central Kansas Foundation. They currently have a mentor program at the Junction City Konza location, which is modeled off evidence-based practices in other areas. So you're starting to see this a little bit more, with the mentors being those that are in recovery from substance use. So they actually go through an application process, they hire them on, and then they take them through some addiction and counseling training. So they are put in these environments so that they can point people in the right direction as far as resources if they currently have some substance use issues. So this is a paid mentor who will meet with patients that might be having these substance use or misuse problems. And this mentor would give them the appropriate resources and follow up with each client. CKF obtained grant funds through the Sunflower Foundation from the Kansas Fights Addiction Funds to offer the mentor program with us in Konza. So we'd be sharing this mentor with the office, which is right down the hall from us. So we did have a representative from CKF come and present this information to us and kind of talk to our staff about what the mentor would be doing and address any issues or questions that the staff had. These are slides from that presentation that she gave. So this is just a little background as to what CKF offers, all the services that they have to offer. Their main hub is out of Salina, but they offer a variety of services in many other counties in Kansas. So this is a map of all of the other services that they provide. So they're pretty spread out throughout Kansas. And the different colors, of course, indicate different services. So the purple markers indicate partner clinics. The green are outpatient clinics. blue are hospitals, and the red is their main building there in Salina. So we're hoping to be on their map soon. So what is a mentor? This kind of explains it a little bit further. This is someone hired on by CKF. So they would do the interview, they do their evaluations, they'd be in charge of this employee. They've gone through the interview process and appropriate addiction training. They would meet with a client or patient based on their answers to 3 or 4 screening questions. And this is something that the client would answer upon when they come into our services. So this is all based on how we as a clinic decide to set this up. In our case, we've reserved this for our family planning patients. And they'd be offered a short consultation with the mentor after their visit in our clinic, if they choose to do so. So of course, it'd be up to them. We're not going to force them to meet with a mentor, but we'll simply ask them if they want to meet with a mentor. They'll go into a room where they'll have more, where they can talk to them confidentially. And if they decide to take part in the resources that they point them to, that'd be great. That's hopefully what we're looking for a successful program. And then the mentor would also document, so they keep notes on this individual and follow up with them as well. So this is just data to support the need for this. Studies have shown that 46% of patients in primary care have used drugs or misused alcohol. 23% of patients in primary care have moderate or high substance use, but less than 7% of patients in substance use disorder treatment were referred to by primary care. So if we can catch it here and let them know that we have resources available for them in our community and actually walk them through that process with a mentor, the chances of helping them are much greater. So as I said, this program or something similar has been successful in other areas. So we're hoping that it will be successful in our area as well. So this is just kind of a map of how it would look from the time that they go through those screening questions, meeting with the mentor, and then out the door. So we're learning from what Kanza has done so far, and we'll hopefully have more data to support the need for this further. Any questions on that? One more thing. You all are invited to our holiday party. Commissioner Ford has taken part of it. Every quarter we have a professional development day, so we reserve a Tuesday morning quarterly for professional development. On December 12th, we've invited Adrienne Ralston. She's coming from the Kansas Children's Services to conduct a training on child abuse and neglect. We also have Julie Hart coming in from the Kansas Attorney General's office to give a presentation on human trafficking. So Adrienne will be there at 8:30, and then Julie will follow with her presentation. And then we'll give our updates and then adjourn. So you're invited to that if you want to come to that. But more importantly, you're invited to the holiday party at 11:30. So we'll have lunch there for you. We usually do something fun like gingerbread houses. We had Commissioner Ford.
Yeah.
This year might be a talent show, so we're still discussing.
I have a feeling that's good.
Yeah.
Yeah. I'm not talented on that just yet, but that's all about the health department anyway. I'm listening to play guitar. I'll make plans. I'll be in there, Julie.
Okay, great. Thank you. And that's all I have. Any questions?
Good morning.
Morning.
So, here to do a quick overview of the public health clinic, just where we're at currently. I do a quick year interview, and we're looking at moving at least into the first half of 2022. Firstly, just a quick review of our primary service line. We focus primarily on immunizations, both routine and seasonal. Family planning, we offer primarily contraceptive services as well as prophylactics, which are shipped in from KDHE. Likewise, we have Teresa Stewart, APRN, who does a lot of our women's health programming there. She offers both annual and acute visits. Likewise, this cancer screening, primarily breast and cervical. That's in partnership with KDHE's early detection works. Likewise, we see a lot of communicable disease, both STIs, tuberculosis screenings, and workups for those who have moved to the county, as well as reportable disease investigations. In the month of October, we saw 1,375 patients. We administered 1,545 immunizations across 1,169 patients. Our adjusted non-COVID immunizations did increase from 4.3 or increased by 4.3% from October last year to this year. We also saw 105 hemophagocytic visits. Financially through the year, this would be through the end of September, so 82.3% of the year. We received 91.2% of our projected revenues for immunizations. November is projected to be our highest yielding month. Again, just showing the fact that October is often our highest volume. Likewise, at that point, we spent 85.1% of that budget. That's really driven primarily by the new vaccines to market, which we'll cover. There's been a lot of changes there. That's definitely driven up our pharmaceutical spend. Likewise, we've had some COVID grants that have been sitting for a couple of years that we're needing to spend down by the end of July next year. So we're trying to spend down some of those on just refreshing tech devices as necessary. So likely that budget will exceed 100% by end of year, but we expect a proportional increase in revenue, as most of it's going to be pharmaceuticals, which we still will better expect revenue on. For some of those new immunizations to market, even though COVID vaccines have been around quite a while, they were commercialized at the end of the public health emergency. Therefore, we're having to pay for private doses. Those retail at about $130 a dose. So that adds up pretty quickly when it comes to our pharmaceutical spends. Likewise, there's been a lot of interest in both RSV vaccines, which are Bristol and Arexvy, and the immunization products, which is Beyfortus. Beyfortus is a little bit different. It's not a traditional vaccine. It's actually a monoclonal antibody product that costs a lot more to manufacture, and therefore it costs a lot more for us to acquire. But Beyfortus retails at about $500 per dose. Bristol is about $295. And Arexvy, I think it's a little bit less, about $275. But we administer primarily Bristol in the clinic. So again, for RSV vaccines, those are for those who are 60 years old and or pregnant. Likewise, for RSV antibodies, those are for kiddos from usually birth to 6 months. That is really just due to a pretty recent shortage that we've experienced with Beyfortus nationally. So traditionally, I think in years past, what has been anticipated is that really birth to 8 months is kind of that window that we really want to get kiddos covered for RSV, but just due to the shortage, they're having to focus on things that are primarily at highest risk, which is that birth to 6 month area. Likewise, we're switching to Prevnar 20. We're just using up the last of our pneumococcal vaccine stock, and we'll be switching. It's more of a one and done. Rather than getting a conjugate followed by a capsular vaccine, you can receive a single Prevnar 20. Just in essence, it's a one and done. Unfortunately, the retail is quite high compared to the others as well. So again, as you can see across these 4 products, it has different pharmaceuticals spend quite significantly in immunizations. We're currently planning. We received 87.83% of our projected revenues. We are expecting to receive additional relief grants for pharmaceutical spends either by the end of the year or beginning of next year. Some of the drugs that we received through the 340B program, or rather that we purchased through the 340B program, it's a national program serving those at highest risk. It basically gives us a discount direct from the manufacturer. A few of the drugs we do purchase have fallen off that program over the past year, which again has just increased our spending a little more. Thankfully, though, we still have stayed under budget for everybody. We've spent so far 79.7% of that budget. Again, we're at least as of the end of September, we were $14,000 over our projected budget for pharmaceutical expenses, which does make up nearly 89% of our total commodity spend. So that's pretty much all of our commodities. A few concerning trends that we are looking at here in the county. First would be STI rates. It's pretty natural for us, just given our proximity to posts and just the demographics of our county. It's not to be too surprising the number, but they are trending up. And we'll look at that here shortly. And just to touch base there are some studies that are being done in the CDC trying to curb some of this. Because again, this isn't just a Raleigh County problem. This is a problem that we're seeing nationally. Just that rates are increasing really to about where they were pre-pandemic. There was a bit of a drop during the pandemic, and they've increased the pre-pandemic levels. So the CDC is just examining a few different methods we might have at our disposal to hold the curbs those rates. Likewise, with kindergarten vaccination rates, we'll talk about this more here in a little bit, but that is something that we're actively working on, trying to increase the vaccination rates of kiddos in Raleigh County. bit tougher to see, but this would be the STR rates for the county of Riley ending in 2022. You can see really that we're at this would be 9.0 cases, STI cases per 1,000 population. So you can see that we're really just approaching where we were at pre-pandemic in 2018. Again, not necessarily just a Riley County problem. This is it's tougher to see. This comes from Kansas Health Matters. It tends to be some of the best data we can get on STI rates and kind of compare county by county. Moving from right to left, the highest the highest rates in the state of Kansas actually in Gary County at 15.1 cases per 1,000 population, followed by Wyandotte at 13.8, Shawnee at 12.3, Sedgwick at 9.3. And if you can see where that little blue outline there, Riley at 9.0, and just to the left of us is Douglas at 8.7%, or 8.7 cases per 1,000, excuse me. So again, we're in line with kind of where we'd expect to be, but just as we've seen rates increase, it does increase our prioritizing trying to curb some of those cases. We've been working very closely with local KDG disease intervention specialist, Allison Hudson. That's been helpful. Unfortunately, that program has received some pretty significant funding cuts on the federal level that happened during the last, I think it was the last Congress budget Appropriations Act, that there were some changes there, and primarily as a disease intervention specialist. So he's been working remotely more with other counties as well. So that has put a bit of a timeline sometimes when it comes to finding some of those cases, but it's something that we are actively working on. I left this here, so hopefully prime me to give you my handout, which is currently sitting on my desk. So what this really is indicating is the level of vaccine coverage in kindergarten classes in the state of Kansas. And the surveying method is a bit unique, which leads to some very interesting findings. Really what happens is the state will contact each kindergarten and will ask them just randomly sample 30 kindergarten students and send their immunization records to the state. Given the nature of sampling, that can lead to a lot of variance. And this handout demonstrates is that year to year, there's a big change. Because again, when you're sampling only 30 students, if you catch a few outliers, that can change your numbers. You know, Riley County has traditionally performed very well. They've been very high. They've really been 10 to 20 percentage points above the statewide average historically. However, it would have been last school year, USC 383 did see a bit of a decline. And we've seen some momentary lapses as well, I think at Blue Valley as well. So we're working currently with 383 trying to catch some of those students early. Again, a lot of it is really just the nature of how the survey is put out. It's again 60 days after the date of enrollment. So if your exclusion date is after that, you probably will have some lapse there where you're really being surveyed before your exclusion date is active at the school level. So that's something just to kind of have on our radar, is that we'll be working more hopefully with local schools trying to do immunizations on site. As dramatic as immunizations can be, we try not to do those on site as much as we can. We try to keep schools very, a very low key area, but given some of the rates and having been contacted by the state, that is something that we are exploring. Other developments, we have been resuming travel vaccines as our COVID vaccine traffic is waned. We've been able to have more margin with staff time to offer those services. We've been offering most travel vaccines at this point, excluding yellow fever, which will be adding likely Q1 of 2024. As I alluded to earlier, partnering with area schools, just doing more vaccine outreach on site when able. Likewise, we're expanding payer pools. So with insurers, that can be a big determinant on where someone receives their vaccines. Is really just who they're covered by insurance wise. And for us, we're trying to really serve as many people as we can, especially with these vaccine outreach events. That can be a big challenge with students is their payer may not be well served amongst pharmacies or providers in the area. So we currently have 2 applications pending. We'll likely be working on Q1 of 2024. Likewise, just working on our purchasing, trying to hone those practices, making sure that we're buying on contract as much as we can, finding the best contracts able. And just with some of the shortages that we've seen both in the vaccine and pharmaceutical markets, trying to find different vendors that may not be experiencing shortages as just to replace it that they're currently on. And then, based on my time, we'll make this my last slide. Lastly, we are working with a few other providers in the area, just trying to strategically partner and trying to serve some of our most underserved in the county. Most recently with Clay County Medical Center, they do operate Riley Family Physicians in Riley, Kansas. So for us, we are an early detection provider. So we work primarily with the state to do breast and cervical cancer screening. And based on our rates, both that we get for pharmaceutical spend as well as our higher cost services, things like colposcopies that we use to screen for cervical cancer, our prices are quite low. So we're working on trying to get some of those patients to be referred to the county level to our county department. Again, just trying to best serve Northern Ireland County as best we can. Likewise, we're working slowly on getting some of our patient portal and our online scheduling built out with our EMR. There's been some changes to that system that it does make it more amenable for our workflow. There will be some unique challenges, I think, when it comes to integrating with the state immunization registry, which is going to be a bit of a time critical measure before we were able to roll out online scheduling, but it's something we're working towards currently. I think that's about it for me. If you have any questions about the clinic or any of the services we're offering, I'd be happy to address them now.
Something I can think of. Sounds like you're moving forward.
Yeah.
Okay.
So we're slowly emerging from COVID.
Yes.
Thankfully, there's been plenty to do for us. Okay. We're very grateful for sure. Thank you.
Thank you.
Thank you.
I need to make a motion to recess as the Board of County Health, and then we'll reconvene as the Board of County Commission.
I'll second.
It's been moved and seconded to recess as the board from the Board of County Health and reconvene as the Board of Raleigh County Commissioners. All in favor?
Right.
Thank you.
Thank you.
Thanks, Julie.
Appreciate it.
Commissioners, do you have any, I sent your emails yesterday about evaluations for department heads. I asked if you'd like them printed. Are you guys, I mean, I sent them electronically. You're more than able to print them. But is there anything I just want to make sure you guys are good.
Oh, go ahead and print them off for me.
Okay.
Yeah, print them off for me too. Anyway.
All right, I will. And then you can label them for which department head, right? You don't need them pre-labeled.
No.
I can do that. And then there's 11, and then I saw your email about the 20th.
Yeah, I just
Leave you 20 minutes.
that'll be fine for the moment, but like I said, I'm gonna have to chair that particular meeting, so if I need some prep time ahead, if something comes up, that kind of puts me in a little bit of a bind. I'm just letting you know ahead of time.
Yeah, we were tracking that you have to log on and you, but we were expecting to be done by the latest 20th bill.
That'll work for now.
All right, we'll just communicate.
And then I had something pop up on the 4th I may need to look at here too, so can you hang back post meeting here to chat?
Yes.
Okay. Yeah, other than that should be fine. I don't have anything else.
Any other business, commissioners? Official business? Okay, John, what's your score?
I can't believe it's a 20.5 point spread.
Yeah.
I think it should be more than that if we are mentally and physically prepared, but I'm not sure the mental reaction after the last game.
I gotta think, we usually come back pretty strong after a loss, particularly like that. Maybe with the exception of the COVID year, but everything's an adverse with that. So, I don't know. Tone, Veterans Day. It's a 2:00 game. I like our chances. I'm gonna say I'm gonna go 40-18.
Greg?
I've got 45-14. Not sure, we're not even scored that much. I think it's gonna squish it, but
Catherine?
I don't know.
None of us do.
Football is tough. I wrote down 45-21.
Okay.
So we're pretty close.
Yeah, Clancy?
Catherine and Greg kind of did me in 44-12.
yeah.
I went 31-14.
Okay.
Okay.
I think we should score 50 on them if we're how we should be, but I'm just not sure how we'll react.
John, I don't know if you track it, but Nebraska only needs to win one game to make it to one game.
For the record, I wasn't tracking, so.
I did not give you that speech.
Appreciate that.
We thought you might actually, you expected to win.
But speaking of, are they,
That didn't happen.
yeah,
No, it was the first game I sat down and watched.
is there's like some new thing going on with the mascot or something?
Oh, I don't know. I thought there was some new thing going back on with the quarterback where he threw it to the other team. I mean,
Well, that's just been standard for about the last 15 years with this. I'm used to that.
colorblind. You
Yeah.
can't tell who he's throwing it to.
It's, that was apparently.
They haven't told him that the N stands for knowledge on his helmet, but that's a whole nother story there.
You think that's funny every time. Every time you laugh out loud.
Every time
Never
it's
outdated.
Yes.
It's never outdated for me either. I like it.
Was it Herbie the,
That's her.
yeah, okay. Yeah. They're talking about changing it or something?
I don't know. I hope not.
That's a little blow up doll.
Yeah.
Analysis, right?
Yeah. Well, they actually have an extra mascot.
You can't have much of a reaction to that.
Guys.
Yeah,
No, but there's one
I think they all.
strange thing as the.
That may be better than the help.
It is.
All the colonel. Listen, we've been to a ball game a long time. I'm excited.
Just don't take your mascot.
No, he's definitely going. I heard he's definitely in.
That and you're like cutting seats out of the equation at this. I mean, what are you guys really doing up there in Lincoln? I gotta start questioning some things here.
Sell it out. That's what we do.
I mean, you're a volleyball school, you know, I mean, what are we doing here?
Yeah.
I have to get my jabs in. I can't. All right, I guess with that, I've had enough of that for today, so. I'm going to make a motion that we adjourn the meeting of the Riley County Commission on this, the 9th day of November, 2023.
I'll second.
So moved and seconded to adjourn the November 9th meeting of the Board of Riley County Commissioners. All in favor?
Aye.
Aye.
Everyone have a great weekend.
Some like my wounds I can't eat.
Now, hold on a second.